we've got a hugely ageing population. We're predicting a 30% growth in older people, particularly those over the age of 85, which is going to have a big impact on our health services. Now, many older people live out in the community, but those that are more frail with more complex conditions live in older persons' residential care, rest home care and hospital care. Frequently the registered nurse is the only person on shift, and so they work in relative professional isolation. They're very skilled at what they do, but what we know is that where they have support from district health boards, they get a lot out of that. It gives them confidence in what they do, but it also improves the quality of care, and that's something that we were keen to showcase. So these videos are about the relationships between advanced practice nurses in district health boards, nurse practitioners and clinical nurse specialists, and their relationship with registered nurses and care providers in residential care. It also highlights, I think, the leadership that's available out there in aged care. Some of the leaders in aged care are doing fantastic things, working around new models of care. The role of the leader is critical in setting the culture and supporting the staff to do the work they do, and I think you'll see in the videos wonderful leaders doing great things.
Our highest need older people are in residential aged care. We knew that from the OPAL study that we did, where we knew that the dependency level has vastly increased over the last 20 years. And so that we wanted to have some way of supporting residential aged care in the harder job that they have to do now. If we're going to go out and do education, we knew that we wanted to do what's called the geriatric giants. What are the most common things that put older people at risk? Now, the people that know that the best are the people that work in residential aged care. They know this really, really well. So there was a couple of things that we wanted to do with the care guides. Number one is to come up with a succinct 2-page algorithm type publication to say these are the major things to remember when you're thinking about incontinence, when you're thinking about diabetes, when you're thinking about falls, any of those kind of major issues for older people. We wanted it to be very easy, user-friendly, easy to use, and quick. One of the idea was to make sure that it was the best evidence we could come up with in a really user-friendly manner. Now, the other part to this that's really important is that the work group, the Residential Aged Care Integration Program work group, that's residential aged care nurses and managers that come along with the gerontology nurses. So that it allowed us to ground the care guides into real life, because they said, oh no, this wouldn't work, or this is a better way to do it. So we GNSs would go out and get the evidence, bring it back, and then they would say, oh, this works, this doesn't work. And then we did millions, many iterations of a care guide until we got to something that really worked really well.